Problems Assembly, Agnes Ann, a network member from Mary Queen, shared her story about her son, Robert. He started using drugs at age 15 when he was in high school. He went to his first treatment program at 18 and was doing well. But drug addiction is a disease. Robert would be clean for a few months, and then the disease would take over again. Ultimately, Robert died of a drug overdose. During our house meetings, we heard dozens of stories of people fighting drug addiction. Our drugs committee, including people from your congregations, has had 26 research meetings with professionals in the field. These meetings have confirmed that Robert's story is not an anomaly. Drug addiction is killing our friends and family. Through our research, we learned that 80% of people who are currently addicted to heroin started with prescription pain pills. Kentucky has passed new laws to limit pain pills in the hope of curbing new addictions. But the people who are already addicted are struggling to survive. Fayette County is second in the state for heroin-related overdose deaths. In 2013, 81 people died from an overdose, and by 2016, it was 162 people. Overdoses have doubled. The fire department used 2,376 doses of the life-saving drug Narcan in 2016. Without Narcan, even more people would be dead. But there is another deadly aspect of the drug crisis. Drug use leads to other diseases when people use dirty needles. There were 757 cases of hepatitis C related to drug abuse in Fayette County between 2016 and 2017. And according to the Centers for Disease Control, Kentucky is one of the states most at risk of an HIV outbreak. Every dirty needle out on the playgrounds next to our school sidewalk or in our church parking lot is a potential outbreak waiting to happen. We need a solution that saves lives. And these overdoses are incredibly expensive. Visits to the emergency room for overdoses between 2016 and 2017 cost over $2.3 million. The average cost of treating one case of hepatitis C is $44,000, and the average lifetime cost of HIV treatment for one patient is $379,000. We need a solution that will save lives and save money.
My name is Yoshiya Togami, and I work as a hospital chaplain at Baptist Health Lexington. Let me tell you some stories from my job. We have reports that people need to be careful when handling trash bags in public areas because dirty needles and drug paraphernalia might be in trash bags. We have been warned not to place our hands in the planters around the hospital because you could be stuck from a discarded dirty needle. We wear gloves to leaf through a John or Jane Doe's belongings to figure out their identity because dangerous, potent drugs that can enter the body through the skin could be laced on paper. People come into the emergency department complaining of chest pain, and the nurses will place an IV. The patient will tell the nurse that they're leaving and walk out with the IV in the arm. The nurse will offer to remove it, but the patient tells the nurse not to touch them. The most likely scenario is that this person did not have any needles and wanted to shoot drugs. through the vein. One definition of addiction that I learned many years ago when I worked as a chaplain in the chemical dependency unit is addiction is watching yourself doing things that you know is ultimately not in your best interest. I find it can be easy for me to be judgmental towards people who are addicted to drugs. But with this definition, I know we are all guilty of some kind of an addiction. However, as in all faith traditions, Christian, Muslim, Buddhist, or Judaism, we are asked to be compassionate to people who are suffering. I don't know what it is like to be addicted to heroin. I hope I don't ever know what it is like. However, I still have compassion towards people who are suffering from drug addiction. I have the hope that they will seek the treatment they need to become what God intends them to be.
Good evening. Van Ingram, the director of the Kentucky Office of Drug Control Policy, said that there's two things that you can do for people who are addicted to drugs. Number one, keep them alive. And number two, make sure they can get to treatment. Every human life is valuable. Recovery is a continuum. And if you can't stay alive, then you can't move along to the next stage of recovery. We need a solution that will enable recovery, save lives, and save money. The Needle Exchange Program reduces the spread of diseases like HIV, Hep C, and Hep B by providing clean needles and a safe place to dispose of those dirty ones. This saves lives. People who go to needle exchange programs are 5 times more likely to enter into treatment. This enables recovery. For every $1 to $2 that is spent on strategies like needle exchange programs, $5 to $7 is saved in healthcare costs. This saves money. But here to share with us about Louisville's needle exchange program is Mr. Donald Davis.
Assalamu alaikum. I started working in the field of harm reduction 20 years ago. I worked in Ann Arbor, Michigan, and New York City, and I retired and I moved to Louisville, and thought I was going to go see Churchill Downs and everything else, and I started having to do this again. I am the syringe exchange supervisor for Volunteers of America Mid-State, and in doing this, other things, I'm one of the co-founders of the Kentucky Harm Reduction Coalition. We do naloxone trainings and distribution throughout Jefferson County and the state of Kentucky. I'm also a consultant for the National Harm Reduction Coalition in New York, and I am a recovering drug addict. And I have been drug-free for 26 years. Any city that has a syringe exchange program, and I've learned this a long time ago, you save money in medical costs, you save lives, and you save the spread of disease, because you're talking about picking up syringes. With a syringe exchange, the syringes aren't there to be picked up because they have to bring a syringe in to get a syringe. We've noticed and we've seen that in Louisville, that there are less syringes on the streets. I have a site at a fire station, and the fire chief comes out and talks to me and tells me, he said, before you got here with the syringe exchange, we were picking up, I would have a 2-liter bottle full. He said, now I barely have a soda bottle full because they're turning them in. When they talk about the spread of disease, because of my addiction, I had hepatitis C, I was cured of it back in the 90s. I've been around a while, and I'll be around a while because before I moved here from New York and retired, I said that I would have to build myself a job when I got here if I wanted to work. The job was already built for me when I got here. Okay? I tell friends of mine back in New York what's going on here. We're a person in New York where there's heroin that they would inject maybe 5 times a day. Here, oh, you're saying, whoa, I haven't finished. Here, I get people to come to the syringe exchange. I ask them how many times a day do you inject? They say 25. Wow. Fentanyl is in the drugs. There's no such thing as pure heroin here in Kentucky or pretty much anywhere else. I always tell people that, since I've been doing this, I've got a couple more years before I retire again. But I think that I'll probably be about 80 years old when I do retire. Because it doesn't look good, but it's getting better. It's getting better every day. And every day, and syringe exchange is controversial. It's very controversial, but it saves lives. It's been proven to save lives. It's been proven to reduce hepatitis C, HIV, endocarditis. And when people ask me about it who are reluctant, I said it is what it is. Thank you.
So based on our research, the needle exchange program that are getting the most people to recovery are doing the following things. They're offering a variety of days and hours in different locations. They're providing as many needles as a person needs for that week. And they have trained staff and peer support specialists. Lexington has a needle exchange program, but it is not following these best practices. It has limited hours. It is only open 8 hours a week spread over 2 days. There is only one location. And staff are not trained to deal with addiction or foster relationships with those who come in. And there is currently no support for peer specialists. At the Nehemiah Action, Bill will present a proposal for a comprehensive plan that will improve our local needle exchange program. This will be the first step in a local recovery model that respects the dignity of life. This solution will save lives and enable recovery. People of God, what are we here to do? Rise up and build.